How's it going, modern manual therapy viewers? Dr. E here, back with another Q&A. This one is from Steve C. Steve says, Dr. E, I have a patient who has originally insidious onset of right-sided lower cervical spine pain with radiating symptoms into the right scapular region and right lateral arm. Over the past few weeks, the pain is completely abolished, but she is left with significant myotomal weakness in the right triceps, maybe a true 3+ out of 5, as well as weakness in right shoulder abduction and external rotation. Her retraction and side bending is symmetrical and non-painful, but she does have a significant loss in retraction plus extension. Would you expect repeated motions to be helpful in rapidly improving strength for this patient, or would return of motor function likely take a longer time to recover? Just not sure how to set expectations for this patient because I have not seen many patients who present solely with motor weakness. Thanks for all your great content and compassion for our field. Been following for years. Thank you, Steve. I always appreciate hearing from my followers, because if it wasn't for you guys, I'd still be stuck just teaching in Buffalo. Not like it's a bad thing, because I do love my hometown, but I do like having the outreach and traveling to fun places and meeting great people like you. So I think this is a good question, and many patients would be ecstatic, and as well as providers, about completely centralizing and abolishing pain. Motor control, if it's either a motor control problem due to perceived threat or inhibition due to perceived threat, that can still be restored rapidly. And potentially, if there's anything remaining left, at least a significant to moderate deficit in something like retraction and extension, for sure, that might be able to restore motor control. And the only thing you can do is work on that repeated loading strategies in that plane. And if that motion has completely returned and her strength is still 3+ out of 5, then she just needs good old-fashioned strengthening, or that kind of loading, not repeated loading to end range, but repeated tissue loading just for hypertrophy, which is going to take, of course, 4 to 6 weeks. Motor control may return. Potentially, she may have the dramatic increases in strength, what appears to be dramatic increases in strength for the first couple of visits. But as we all know, true tissue adaptation and hypertrophy takes about 4 to 6 weeks with progressive loading up to 80% of their 1 rep max, and that's pretty much what's needed. So you could always try, and it's either going to rapidly return or not. And that's how to set your expectations for this case and for her. Either way, it's good news. Just say, hey, look, 50% of this or 80% of this, depending on how she perceives it, is done. And we just have a little bit left to go. And just some more hard work is going to get you back to full function. So always remain positive. I hope this answers your question. If you like this, check out modernmanualtherapy.com, which has over 600 videos and counting. It's our premium e-learning site. Check out all our products on edgemobilitysystem.com, including full seminars, mobility products, BFR certs, the original ISTM tool, the Edge tool that's pocketable and handheld, among many other things. Check out our podcast on UpDoc Media, and make sure to subscribe to us on modmt.com/YouTube, Instagram, or Facebook, or Twitter, and that's the easiest way to follow us on social media. Also, check out themanualtherapist.com, subscribe via email so you get awesome exclusive discounts and weekly updates for our daily blogs. Have a great day.